Good afternoon and welcome everybody. We're broadcasting from Candy Gardens, a beautiful part of Guernsey, a beautiful part of St Peter Port. And today, I believe we're going to make an announcement. It's another stepping stone, moving away from restrictions that we've all had to live with and suffer over the past 14 months or so. In fact, I'm told that it's more than 400 days, i.e. since the 19th of March last year, that we've had a 14-day self-isolation rule imposed on travel into the bailiwick. Now, that was the beginning of a response to this thing we'd never heard of, pandemic. That was something we saw in a dictionary, didn't know what it was, and the restrictions and the way of life that it forced us to live with over that last 14 or 15 months. We still didn't know then how it would affect us, and we didn't have the tools in our armoury to be able to satisfactorily deal with it. But we've learned. Now, a lot has happened, but to a greater or lesser extent, the travel restrictions have remained in place. And as I say, we've had to change the way we've lived our lives, to change the way about how we travel. Now, restrictions is a horrible word, but we've had of necessity to endure them. Think back to March last year. The borders were closed. We didn't expect them to be closed. We didn't know how long they were going to be closed for, and we wanted to reopen the borders as soon as possible and as soon as it was safe to do so. But what was going to make it safe, and what's made it safe, or a lot safer, are vaccines. And I'd like to thank everybody who has responded and had their vaccinations, and I'd like to encourage those who haven't taken that opportunity to still take it. It's still important, because that's the greatest weapon we've got to make sure that we can live our lives normally going forward. Now, we said, and we've been saying for some time, there would be a big shift in how we're going to deal with things from July. And July is the case that we intend to see far fewer restrictions than we've had to live with to date. But, and it's a very important but, we're still fiercely going to protect our community and take such steps as we need to. And there's no guarantee in relation to anything that we do, because if we need to take steps to otherwise move forward, we will do so. We sincerely do not believe that will be the case, and we believe that the steps we're mentioning and detailing today will be ones that we can live with, and so that our community can enjoy the freedoms that they've been restricted in greater or larger measure over the last 14 months. Most adults have had at least one dose by now. By July, even more people will have done so. I commend Dr. Brink, I commend all of those involved in the vaccination policy for the truly excellent work that's been done. But I also commend the citizens of the bailiwick for their cooperation. Now today, we're going to unveil some core rules which will form the basis for the travel regime which we intend to bring in from the 1st of July. Some aspects will be similar and are a continuation of what we're going to do now, because there will be still testing and self-isolation requirements for those travelling from countries where the risk is still great. But for the first time since March the 19th of last year, travel from the UK and some other destinations where the risk is low will not require either self-isolation or testing. Now, Dr. Brink and Deputy Salisbury will explain in detail shortly those rules. But I say in detail, they'll give you the best information they can currently give you, but information will continue to be given over the forthcoming weeks as matters develop. We only agreed these set of rules yesterday at the Civil Contingency Authority, and operationally there's still work to be done in relation to that detail. But the Chief Executive, Mr. Whitfield, will comment upon those. But as I've already said, we're not going to have all the answers today. We're sharing the plans that we've got with you as early as we can, because we want you to know exactly the route that we're taking and the reasons that we're taking it. Now, after the presentation today, I'm sure that lots of people have questions. Some will want to know more details about the rules. Some will be anxious that after all this time we're moving to significantly unrestricted travel. And some may think it doesn't go fair enough. We understand all of those viewpoints and we respect them all. Now, we want to give you the chance to put questions to us. So next week, we're going to have another briefing at 1 o'clock on Friday, and that will be specifically to answer the questions from the people of the bailiwick. So over the next week, please email your questions to COVID-19 inquiries@gov.gg. I'll repeat that, COVID-19 inquiries@gov.gg. And please, if you would, title them public questions in the subject part. Now, we'll collect all of those and try and answer as many as we can next week. We'll also update you regularly between now and the 1st of July on the travel rules now they're developing. Now, most of all, I want to stress right now that there's still plenty of time for things to change. And we will and need to, and we will in fact react to those developments. There will be new variants, no doubt, and we need to revise if possible, and we may need to delay our plans. We hope we don't have to, but we're just telling you now that this is the best information we can give you as of today, but things will undoubtedly change between now and the 1st of July. I've got to emphasise again that this is a fast-changing situation, and we must all be ready to react. Now, one of our key features of our new travel rules is a closer alignment to the UK's own travel rules. But this government in Guernsey will continue to have the ultimate say on what we believe is safe and correct for our community. And we emphasise that, what's safe and right for the community. And we'll do what's best for Guernsey, Alderney, Sark and the Bailiwick in general. So both the Civil Contingency Authority and the Public Health Team will be ready to react to changing situations as needed. Even if our larger neighbours, or even our not so large neighbours, for whatever reason chose not to do so. So I'm not going to delay further. I'm going to hand over to our equivalent of Harry Kane at Dele Alli, which is Deputy Salisbury and Dr. Brink.
I'll put in for a transfer, shall I? Thank you, Deputy Fairbrash. It was 54 weeks ago that we published our exit from lockdown framework. The intervening period has been one of highs, such as on 21st of June when we got rid of all on-island restrictions, and lows when on the 23rd of January we went into lockdown too. Throughout most of this time, we've had more freedoms than many others around the world, and certainly from our nearest neighbours. However, to all intents and purposes, we have been isolated from the rest of the world. We know this has been incredibly hard for many, and especially for those like us here who have family and friends, close family and friends in the UK and further afield. Now, on the 5th of May last year, Dr. Brink and I went through the framework and told you how our exit from lockdown would go through 6 phases. We told you how we could advance through the phases and what would take us back again. That framework has been tweaked through the following months, but what has always stayed more or less the same is phase 6, the final phase. We said that, and I will quote from the framework, detailed consideration will be given to phase 6, the bailiwick's return to the global community, in due course as part of the post-pandemic era. And then we further went on to say that this is likely to only occur when there is a vaccine available or the public health risk assessment indicates that COVID-19 no longer poses a significant threat to the health and well-being of islanders. Well, as Deputy Fairbrash has just said, we're really pleased to be able to advise you what phase 6 will look like and tell you now that thanks to the amazing work of the community and the support you have given us over the last 14 months through lockdown and through the support you have given through the vaccination programme, which has seen a most amazing uptake, we can give a date when, all things going well, we can move to it. So Dr. Brink and I now are going to resurrect what will possibly be, for the last time, our double act, on COVID anyway, and help explain what phase 6, our new normal, will look like. So over to you, Dr. Brink.
Thank you very much, Deputy Salisbury. And I have to say, it was May this time last year, and it seems incredible that a year has passed. But we said at that time, and Deputy Salisbury and I spent a lot of time talking about the pivotal central role of an effective vaccine against COVID-19. And we're so pleased to have started rolling out the program in December of 2020. Now, I know some of you have seen our tipping point scales before, but what you now see in our tipping point is the heavy lifting is moving to the most of the protection being afforded through vaccination. So just to remind you, we had our non-pharmaceutical interventions and our vaccination program. So non-pharmaceutical intervention include measures such as border controls, school closures, at the most extreme lockdown, but other measures such as hand hygiene, such as face covering wearing. And as the effective vaccine became available, our reliance on non-pharmaceutical interventions is changing, and that includes the border controls and isolation after arrival into the island. And you're seeing the protective efficacy of the vaccination program impacting on our population-based protection against COVID-19. So it really is a very, very historical day for us. And as we mapped out earlier this year, we talked about the Bailiwick Blueprint, which really was an extension of our exit from lockdown strategy, and was to try and share with islanders what that exit first, the final stage of the exit would look like. And as you know, at the moment we have a focus on the prevalence of infections in various jurisdictions, regions, and the restrictions when people enter the Bailiwick are based on that. We are moving away from that now, and we're moving towards a focus on vaccination. Now, that includes the vaccination status of a jurisdiction, a country, a region, and that's important because you then are looking at your population-based protection through vaccination. So how protected is that population? And we're matching it to the protection of our own island population. But also within that, we are looking at individual vaccination status. And that's in line with some of the recommendations from the European Centre for Disease Prevention and Control. So we're using both of those. And those are core, but also absolutely essential is the progress of our vaccination program. So what you'll see in the first table is I've now divided it into whole population vaccination status, the over 16s, the over 18s. Now, the over 18s is basically what is your adult population. So the current vaccination program targets all over 18s and those with certain high-risk needs. And then we've got the over 50. Now, the over 50 is important because that's the end of the phase 1 of the vaccination program. So I want to start off with the whole population. Now, the whole population includes children, so they are counted into that. So if we look at the whole population, 59% of our whole population have had at least one dose of vaccine. If you look at a combination of the phase 1 and phase 2 of the vaccination program, which is basically everyone over 80 living in our islands, 74% have had at least one dose of vaccine. But importantly, if you look at the over 50s, and bear in mind that JCVI followed largely an age-based vaccination program, so we're looking at the age-based effect of morbidity and mortality of COVID-19. 92% of people in the Bailiwick have had at least one dose of vaccine. And that really is a phenomenal response to the vaccination program. That equates to just over 59,000 doses of vaccine. And I would like here to pay tribute not only to the people that have rolled out this vaccination program, but also to islanders who have engaged in this program. So not only are you receiving a vaccination to protect yourself, but you also are receiving it, and on behalf of your community, you're providing protection for your community as well. So really a huge testament to the amazing Guernsey Together spirit, and we need to be very grateful for everyone's engagement in this. So if we then look at the moment where we are with the prevalence data, and this is just taking a step back from vaccination, a focus on where we are at the moment until the 1st of July, to enable people to understand and plan for the period of time between now and July, what you can see is that the southeast, southwest, and the whole of Wales, Jersey, Isle of Man, and the Scottish Islands are all in category 2 at the moment. So that, as you know, is a test on arrival, self-isolation till you get that result, passive follow-up till day 14, and another test on day 7. Now, I think it's always important to be aware that you can get regional variations in prevalence, and even as we move on to vaccination matching, from the 1st of July, we will always be looking at matters of public health concern. So we are always looking at the protection of islanders. And as you can see from the map I'm showing you, is the Republic of Ireland still has a prevalence of above 100 per 100,000 using the 14-day prevalence rate. So we need to be aware of what's going on across various regions. And as people move towards the 1st of July, people are obviously really interested in what is happening in the UK with regard to trends. And if you look at the middle line, which is the red line, that's representative of England as a whole. And what you can see is you've had a decline, but now you're having a plateauing off. Highest, of course, is the orange, which is Yorkshire and the Humber. And again, you had that decline, and now you're seeing plateauing off again. The southwest and southeast are all below 30 per 100,000, so they're all category 2. But what we're also seeing in some areas is an uptick in the number of infections, which shows that we must continually monitor the situation closely. And there you see the northwest of England, you're seeing that uptick of infections there. So important that we monitor this and take into account of what's happening across regions. Now, I've separated Scotland out, and particularly looking at the northeast and Scotland East and Scotland West. And if you look at Scotland East, what you're seeing there is an increase in the number of cases, and indeed you're seeing in Scotland East an increase as well, perhaps not to the same effect, but a gradual increase there, but in Scotland West quite a significant increase. So again, as always, monitoring the trends and looking at what's happening is important. So one of the questions that I was asked this week is, what worries you? What keeps you awake at night? Now, there's nothing that panics me at the moment, but we do need to keep an eye on things, and there are certain things that concern me and mean that we need to continue to be vigilant both now and into the rest of this year. So first of all, I think you're all aware of the variant B16172, which is a variant of concern that originated in India. They're looking at issues such as the transmissibility, its ability to cause disease, vaccine sensitivity. So all of that is being monitored really closely. And obviously, as we've said on so many occasions before, this is an RNA virus, and RNA viruses are more prone to mutation. And so as always, further variants of concern may emerge. So we need to be vigilant, and that's why we want to have that on-island sequencing capacity so we can monitor really closely. So even after we progress past the 1st of July, we will look at prevalence of infections in regions, not as a prime reason to dictate what our border policy is, but to see if there are issues or matters of concern that would warrant a public health override. So we would look at that and we'd say, we're concerned about that region because of that reason, and we therefore are reclassifying it. Other things that worry me in various areas and regions are low levels of vaccination. If you have low levels of vaccination, that population is not going to be protected in a comparable way. And of course, evidence and data. I think I must have said that so many times to you, but we cannot have reliable programs and policies unless we have that reliable data. So if a region doesn't have reliable data, it's impossible for us to do a proper risk assessment. And we may say, well, from a public health perspective, we're concerned about that area, country, because of the lack of available data. So those are the things that concern me. They don't panic us, but they concern us and mean that we need to keep a close eye on things. And I'm going to hand over to my double act now.
Thank you. Okay. So, the strategy. Now, as Deputy Fairbrush just said, this has been approved by the CCA yesterday. So we're going, as Dr. Brink talked about, moving from an environment where we're considering prevalence levels and looking more towards vaccination. But the key to this is learning to live responsibly with COVID. A lot of people over the last year have said how we need to live with COVID. It's not about, it's how we can live with COVID responsibly. And that means covering off all the stuff we've talked about over the last year: catch it, kill it, bin it, hand hygiene, considering your space, employees being encouraged to stay at home if they're not feeling well. All those things that we've tried to drill into people over the last year, which all help that should we get COVID here, stops it spreading rapidly. The strategy is basically a return to less restrictive travel, and I'll go a bit onto that in a moment, but that is the essence of it. We're trying to get back to a new normal. It won't be absolutely normal, it'll be absolutely what we had before March last year. There will still be controls, but to understand that this is going to be different from what we've had over the last 14 months. And alongside this is the Sustainable Recovery Plan, the government work plan, and that will be published on 16th of June for debate on the 21st of July, and that is the other side of this, how we come out of COVID, how we deal in a post-COVID and Brexit world. And also, the whole thing acknowledges uncertainty. Dr. Brinks just talked about variants of concern, what might happen with the B16172 that is causing some concern at the moment. We're not going to ignore that. This isn't about saying, right, well, we're going to move to this, and we're going to forget all about everything else that's going along. It's not that at all. And we'll go through it in a minute, and I'll show you the... Now, this I know will look like a lot here. Do not worry if you do not pick it up in one go. We are going to be talking about this a lot over the coming weeks. We'll take questions on it, and we'll give more and more detail around it over the coming weeks. What we want to do at the moment is just give you an overview, to give you a flavour of what this means. So what we're actually looking at is aligning to the UK's traffic light system of the green, amber, red. Now, I say align, it doesn't mean say that we're going to adopt it, because we very much believe, as we always have done, there's always a Guernsey element to all this. And so whatever we do, there will always be that public health override, considering issues that will be important from a Guernsey perspective. So we'll have green, amber, red countries, just like the UK, and how much isolation, or if anybody has any isolation, will be determined by the country they come from, but also that vaccination. And we've also added blue, which is the common travel area. Now, they don't call this blue in the UK, but effectively there is a common travel area which comprises England, Scotland, Wales, Northern Ireland and Republic of Ireland. And we're using that as a specific region that for the purposes of these border controls. So I'm now just going to go through each one in a bit more detail. But as I say, don't worry if you don't pick it all up now. There's going to be loads on this over the coming weeks. So blue is cool, I guess you could say, because that's the one where you don't need to have any tests, you don't need to self-isolate at all. Now, this will be from anybody coming from the common travel area, or, and this is where the vaccine comes in, somebody might come from a green list country, UK green list country, and that person has a full personal vaccination history. So people that follow those two links will be able to come to the island without self-isolating. But we are expecting everybody will have to declare their travel history over the previous 2 weeks. As I said, this does not mean that everybody from those countries in the common travel area, or indeed from every particular region, that will necessarily be the case. There will be public health overrides. And I think, as you might have seen from the slide that Dr. Brink showed earlier with Republic of Ireland in red, I think that is an area where we would put conditions on it, because clearly that prevalence level is over 100 per 100,000. For us, that would be a cause of concern, and we'd be looking at putting some kind of restrictions on there. There might be a region that pops up, and we might think that's a cause of concern. And so that's how it works. So people shouldn't worry that that's it, let the UK run amok and we'll let everybody in. So it's not going to be like that at all. So then we have the green and amber countries. And from green countries, if you come from a UK green list country, I think at the moment Portugal is one of them, and that person doesn't have a full personal vaccination history, or somebody who comes from an amber list country but does have a full vaccination history, they just have a test on arrival and a test on day 7, that they self-isolate until that negative test on day 1, but then it's just passive follow-up until day 14. So again, it's not having to do anything other than have that first test, but we are asking people to don't go to care homes, to go to hospitals, etc. So just what people should be used to now. And again, disclosing their travel history. So what we're saying here is that for anybody who's got a full vaccination history and they're coming from a green country or an amber country, that vaccination enables them to get a preferential isolation or testing requirements. So if you're in from green, you can follow the blue channel. If you're from an amber country and you've got full vaccination history, you can follow the green channel. Now that changes when we get to amber. So we have from the country of origin is a UK amber list country, and the individual doesn't have a full personal vaccination history, then they have to test on arrival, test on day 7, and need to have a negative test on day 7 before they can emerge from self-isolation. And then again, we ask for passive follow-up. You'll see that we don't say that anybody coming from a red list country, if they're fully vaccinated, can get preferential treatment. And that's because the risks are as determined, and the modelling shown that is too much of a risk. So it's only for if you've got full vaccination history, if you're from an amber or green country. And then we say red list countries, and basically this goes back to 2 weeks self-isolation in effect. So test on arrival, test on day 13, self-isolate until you get a negative test. So that's what we've been used to over the last year, 14 months. So I say, don't worry if you haven't picked all this up now. It will be on the website, but we are going to do far more to make it clearer. And also, as we go onto this slide, explaining how it will interact with UK requirements for green, amber, red, because clearly people coming from a country outside the UK and going to the UK will have to undertake certain tests. We don't want to go through all the scenarios about what that means for Guernsey residents now. It can get complicated, and really what we're trying to do is keep things simple for today. But just to say, we are looking at this. We're also talking to the UK about how things can be done for Guernsey residents in particular in terms of transit, and so if they have been coming from an amber country. But this is just really to show you what the UK requirements are. They're quite simple. I think for everywhere you come from, you have to do a pre-departure test before you come back. You have to have a PCR test within 2 days of arriving. And then, depending on whether you come from a green, amber or red country, will determine whether you have to quarantine and where you have to quarantine. So that's really just to give you a high-level overview of the requirements from the UK. And so, as I just said, what does transit through the UK mean for you? This is something we will be giving you more information on in minutes. Are variants and trends giving us concerns? Yes, Dr. Brink has spoken about that, and we are not ignoring them. It's very much, it will still be business as usual. COVID will not, from a government point of view, does not go away. That's why it is a key priority within the government work plan. We know we're going to have to be monitoring this and covering this and looking at this for a good while yet. And just to reiterate what Deputy Fairbrash said at the start, we are looking for questions directly from the public for next week. And if you've got some, and I'm sure there are quite a lot out there, here is the email address on the COVID-19 inquiries at gov.gg. Back to you.
Thank you very much. Thank you, both of you, very much indeed. Straight over to our Chief Executive, who will deal with some of the operational considerations that will be effective from July.
Yep. Thank you, Deputy Fairbrash. Just a few practical items. As Dr. Brink and Deputy Solsey have explained, the new travel rules for July onward will mean much more travel without the need for self-isolation. But this is not yet back to what travel was like before the pandemic. As explains, there are still restrictions for those that come in under the new green, amber and red categories. That includes testing, which will still be carried out in the same way, with a self-swab test taken at the port or airport and a second self-swab that you will take away with you from the port. There will still be a charge for those travel-related tests of £25 per test. That means our testing facilities set up at the ports of entry will still be needed. I'd like to mention a couple of points about the travel tracker particularly. Importantly, all travellers, including those coming from the blue category from July, will still be required to fill out the online travel tracker and in doing so provide their travel history. This is part of our ongoing surveillance and defence mechanism. In terms of making movement through the border as quick and as efficient as possible for you, I would remind everyone planning to travel to remember to take your laptop, tablet or smartphone device, and importantly, your travel tracker password, as this will get you through the checks far more quickly and smoothly. I would add for travellers, your mobile devices are also required on your day 7 or 13 test if those tests requirements are applicable to you. Similarly, private plane and boat users travelling in from other jurisdictions will also need to follow the rules and requirements. Our law enforcement officers will continue to carry out checks on those who are required to self-isolate to ensure they're following the rules, but also to ensure they are supported and managing okay in self-isolation. But breaching self-isolation requirements could still see you taken to court and landed with big fines. So whilst the categories for travel change, and for many there will be fewer restrictions, many other aspects of our travel arrangements will continue as they are now for some time to come. There are a lot of details that our officers are now going to dig into, as the core rules presented today to you are, as agreed by the CCA only yesterday. So as Deputy Salisbury said, we'll bring you more information on the travel rules for July as we work through those arrangements. We may not have all the answers today, but as stated by Deputy Furbrush, we wanted to be open and clear with the community on where we are, why, as early as possible. What the CCA decision on these rules does mean is we can start to do a lot more to support our tourism sector, the industry that has had the toughest time of all throughout this pandemic. With the UK residents now being able to look to Guernsey as somewhere for a safe break this summer, we can start to promote that sector, and our officers are working with business leaders to plan that promotion, which we do intend to ramp up very soon in time for July. Separately, there's a couple of things I'd like to highlight about our ongoing vaccine programme. First, a shout out to anyone who is 40 or older and has not yet booked their vaccine. We need you to do that very soon, by 12 noon tomorrow, please. The number to call is 220 006. That's 220 006. We understand some people are delaying, hoping they may be offered their choice of vaccine. But even if you delay, we can't guarantee that. We are continuing to follow the JCVI guidance to ensure we provide the appropriate vaccine for different age groups. Most of all, if you delay your vaccine, you delay the whole programme as a community, and that could delay our ability to move to the new travel rules which we're announcing today. We need everyone's cooperation to reach that goal. And that brings me to a final point, which is to say a big thank you to one of our teams in particular. The call handlers who have been working on our vaccine programme, as well as those on other helplines. You'll have seen the message we put out this week, asking people to be kind to those working on phone lines, trying to organise everyone's vaccine appointments, and the worrying grief and abuse they've had to put up with. It's not fair, it's not acceptable, and honestly, it shows some people still haven't twigged we're dealing with a serial global crisis. I know it's a minority, and so many of you have said kind things and complimented the hard-working work of all our teams who handle thousands of calls, so thank you for those words. I just wanted to finally add my voice to those who have said that kind of abuse is simply not on, and to add my thanks to our staff, who I think are doing a fabulous job. Thank you.
Thank you very much, Paul. I agree with those last remarks. Well, I agree with all the remarks, but I agree with those last remarks. Thank you to the people who've done a fabulous job. And I appreciate people are stressed, but don't abuse people. Speak to them civilly. If you've got a problem, explain it to them. Just don't be rude to people who are trying their best to help you. 3 further points. Firstly, I've already said it. Thank you to the people of the bailiwick for the way they've responded to the vaccine regime. But it really, nearly there is not good enough. We need to have the final push. Everybody should cooperate. Everybody should take the vaccines unless there is a very, very good reason to the contrary. Again, I like my football analogies, as people know. The way we're going to score the goal that wins the FA Cup final, and Spurs haven't done that for a long time, but the way we're going to do that is by continuing with the vaccination programme. Please do so. The second point really relates to there's a survey on long COVID, which you can go online on. Now, that's very important. I think it's at about a 15% take-up so far, but we're going to get there because the consequences of long COVID are important. People are going to have to live with this, the consequences of that, sadly, in some cases permanently, in other cases for a very long time. So please cooperate in that regard. And finally, another good piece of news. You may have seen the announcement this morning from our Overseas Aid and Development Commission, but in case you haven't, I'm pleased to tell you that the Commission has agreed to an emergency award of £85,000 to UNICEF UK. Now that is for the charity's COVAX initiative, which will enable equitable access to vaccines around the world. Now, the population of this bailiwick is about 65,000 people, and that £85,000 will enable and allow about 65,000 people to receive 2 doses in countries where they're less able to afford vaccines for their own communities. So thank you to the Commission and thank you to people for their generosity. Now it's open to the media for your questions. And it wouldn't be right if it wasn't Juliet who asked the first question. Juliet.
Good afternoon, panel. Juliet Puto from the Guernsey Press. It seems from today's presentation that proof of vaccination is going to become increasingly important. I suppose it's only 5-6 weeks' time when we go to the 1st of July. I suppose I've got 2 questions here. One, what will Guernsey accept as proof of vaccination for people coming in? And what sort of situation are we having for us proving to other places that we're going to that we have been vaccinated? Where are we with our vaccine passport development?
Yeah, I'm happy to. There is a lot of work going on behind the scenes to make sure that what we do here is acceptable around the Crown dependencies and the UK. So I know a lot of discussion going about what we can do. I think the first drafts have been put together, and I think Chief Executive can say more about what the output is so far. But yes, there's a lot of work going on, and I think what the output will be in 2 stages.
Yeah, we have it designed. It's almost complete in terms of we think it's a match. We're working very, very closely with the other areas we decided in the common travel area. So we've got synergy. We've explained to you before there's some difficulties of having that synergy across Europe. But we've built in something that we believe is the design standard being shared across the UK, so very similar. And also adding to some of the good things that we've done, we're hoping not only with the hard copy version, but also to build it into the travel tracker, so that'll be a good way of being able to take it with you, and it's portable and it'll be recognised.
Just one supplementary question. Do you have an idea when that will be in place? When will we have that in our hands or on our phones? When are you hoping that will be with us?
Certainly in time for July.
Next question, please.
Matthew Leach, Bailiwick Express. A quick question for you, Paul. You gave a deadline for tomorrow for 12 noon for over 40s. Why? What happens after that deadline?
Well, as ever, and I think Dr. Brink would explain this probably more eloquently than I would, but it's all a case of using our vaccines. We know we've got the Pfizer and we've got AZ, and it's making sure that we're using those to best effect across the age cohorts. I don't know if you want to add anything.
Just to keep up with our fantastically low vaccine wastage. When we last looked at it, it was 0.01%. So we want to use our vaccine up. So with our scheduling of clinics, we defrost vaccine, and we want to try and use the appropriate vaccine for the appropriate age group, and vaccinate as many people as possible.
Yeah. Next question. Ewan.
Ewan Duncan from BBC Guernsey. Question for you, Dr. Brink. I know you made reference to the Indian variant, as we all know it, but you said it's not causing you too much concern at this point. Excuse me. Is that because when we saw the Kent variant sweeping through the UK, there was less vaccination in the UK, and now we're at a point in the UK where we're seeing more vaccination, in fact, even the UK stepping up those areas of vaccination? Does that give you confidence moving towards July?
So I think B16172 is a cause of concern. I think what we've got to do is look at our local response. So we're looking at the transmission, we're looking at data, whether there's any increased virulence. Don't forget, from the time of infection to the time of hospitalisation, you're going to have a lag of 10 days, 2 weeks. So they probably haven't seen that peak of hospitalisation following the introduction of that variant into the UK, and they're obviously looking at vaccine efficacy. So just to remind you all is that we've always done a dose interval with the AZ vaccine of 10 weeks. So we will have, by the 12th of June, have completed phase 1 of the programme, dose 1 and dose 2. So we have stuck with that dosing schedule. I think other jurisdictions, what they've done is they've reduced the dosing schedule slightly. That's because they originally had a 12-week gap. So I think we need to be vigilant. We need to look at the evidence as it comes out and respond appropriately. And as always, it's a calm, measured, evidence-based approach. And if there are matters of concern, we would take it back to the CCA, to the senior leadership team for further discussion. But I think the measures we have in place at the moment are proportionate to the potential threat.
Next question, please.
Louisa from Channel TV. Obviously, with the current categorisation that we have at the moment, it's kind of updated on a weekly basis. Is that kind of the similar schedule that you'll be following for this new kind of travel strategy? Will it be updated as regularly?
So it's actually updated 3 times a week, not weekly. So it's updated Monday, Wednesday, Friday. So we do like to keep our schedules updated as soon as much as possible. So we will be looking at the detail of how we implement it. What we're presenting to you now is a high-level strategic overview of what people can expect from the 1st of July. The actual nitty-gritty of exactly what we're going to do and how frequently we'll update it, we'll have a look at that in more detail. But I would expect at least weekly look at it. Probably more, knowing us, would want to look at it more frequently.
Okay.
Yes, thank you. For Dr. Brink, I think, how much of our population do we expect to be vaccinated by the 1st of July? Is there a level we need to get to?
So there are various debates about what constitutes herd immunity, which I think is indirectly the question you're asking me. And that does, to a degree, depend on the R number, which depends on the transmissibility of the various variants of concern. So I think the level we've got in the over 50s of 92% is really encouraging. We would like to keep the levels as high as possible, but modelling an exact number is difficult. We'd certainly like to have at least over 70%, but preferably far higher than that.
Okay. Juliet.
The travel tracker, you've detailed how today you've got to give your 14-day travel history. We had someone get in touch with us this week saying in the past it's only been a 7 days worth of travel history. Has that changed? And if so, why was 14 days felt to be the right length of time of history of travel to give?
So that's correct. That has changed. But don't forget, you were having a period of isolation, self-isolation after you arrived. So it wouldn't be proportionate if you're going to do 7 days of self-isolation to then go back for a longer period of history. So we've standardised it at 14 days. The selection of 14 days reflects the incubation period of the virus, so 2 to 14 days with a medium of about 5 to 6 days.
Ewan?
Another one for Dr. Brink. There's news in the last couple of days that the Pfizer vaccine may no longer need to be stored at such low temperatures as we originally thought. So they're saying somewhere between -15 and -25. Is that the information that you're going to work to now, and how will that affect the arrangements in place for Alderney?
So we're already operationalising that. So we became aware of that data sort of 2-3 days ago, and we're already operationalising that. In relation to Alderney, it relates to the transport of a defrosted vaccine over, and the fact that the mRNA vaccines are quite fragile, and the sharing of the vaccine during the transport period. So we don't have any data on how that would impact on the vaccine and whether it would impact on the efficacy of the vaccine. So it is still our intention to bring 18 to 39-year-olds over to Guernsey for their vaccination. We believe very strongly that we need to offer an equitable programme to all citizens of the bailiwick.
Does the new temperatures give you some more flexibility in your vaccination programme?
It does. With the delivery, it gives us flexibility in the delivery of the programme. So any relaxation of the restrictions with regard to storage and delivery is welcome to us, because it does give us greater flexibility, absolutely.
Yes.
Just another vaccine question. We're seeing around the world now more jurisdictions allowing vaccination of younger people. I think currently we can vaccinate down to 16-year-olds. When are you possibly expecting we're going to start looking towards vaccinating younger people? And I know it's hard to predict, but what are you kind of expecting to happen, and what sort of timescales when it comes to young people?
So there are 2 things that are being considered here. One is the vaccination of the under 18s and what age you go down to with the under 18s. And as ever, it's a risk-benefit analysis. So that is being considered by JCVI at the moment. And as always, we will follow those JCVI guidance. The other hot topic that's currently being considered is the booster programme, and exactly who we should boost and when we should boost them. So those are 2 things that we're looking at operationally, how we would deliver that. But we need to have more precise guidance on that.
Can I just add to that and say, well, the 1st of July was chosen as a date that would be able to get all over 18s to have had at least 1 dose, and all over 50s 2 doses. So dependent on what comes out between now and 1st of July, there might be, we could start looking at under 18s and however far down that JCVI consider appropriate after the 1st of July.
But the great thing would be to vaccinate everybody where it's safe so to do so, whatever their age. That's the point. Because, as I say, it is, and I emphasise it again, others may not like the answer that's given, but it's the truthful answer. It is the greatest weapon we've got against this horrible virus. Somebody else had their hand up. Matthew, I think.
Yes. When the category system comes into place and somebody comes to Guernsey on holiday for, say, a weekend, but they test positive on arrival, do they then, I guess, have to isolate until they have a negative test? But there's no option to go home then? No. Okay.
If they're positive.
No, they're here. They've got to then, they have to do the full self-isolation period. Yes, you had.
Correct me if I'm wrong, I was aware that when we announced various things months and months ago, that signing into venues was going to stop at the end of April. It appears from personal experience that I've visited venues and hotels that we're still signing in at venues. Can you explain why we're doing that?
I'd actually say good. Yeah. That's responsible people running a business, and we want that. We want to encourage it and people to think, COVID, what spreads COVID in terms of other diseases as well. I mean, how you can spread colds and flu. So, yeah, good on them for doing it.
Yeah, absolutely.
They were saying it's because the states had asked them to carry on with it, even though you told us we had to stop at the end of April. Is that wrong, or?
I mean, the idea is, it's the point that Dr. Brink has made throughout all these various broadcasts, that we've all tried to make as well. It doesn't, just because there isn't a rule, doesn't abure you from not taking personal responsibility. So if hotels and places such as are taking that stance, good for them, as Deputy Salisbury has said, absolutely good for them.
I think that they have been encouraged, business owners have been encouraged to do so. But in the same way, if you go on the website and you have the more deep dive on travel, we'd be encouraging people, particularly if they're in their passive surveillance or in their second week, to actually just make a note of where they're going and who they've seen, because it all helps in living. I think Dr. Brink has emphasised that, living with COVID responsibly, and we might have to just do things a little bit different for the next 2 or 3 years and be conscious of it, as Deputy Salisbury, about our hygiene, how we do things. We mustn't get to the complacency bit where actually, the end of July, everything drops away and we carry on completely. I think it's about our individual responsibility.
Part of the new normal.
I think everyone in Guernsey is very conscious that, of course, we've been very cautious during this pandemic due to obviously our older demographic population and our limited healthcare facilities. I'm conscious that we've been following the UK with our new amber and red system, but do you expect us to possibly be more cautious? Do you expect us possibly to have more amber and red countries than the UK would have, because of course our careful situation?
I just go back to what I said before. We will look at this from a Guernsey perspective. You might have seen, I know there have been questions about whether some countries in the UK should have gone red before others, but then from the very beginning, we designated, I believe, Tenerife to be an area for self-isolation. If we hadn't done that, we wouldn't have picked up those first cases. So we will always consider and have our own team looking at things for us, and that's how it's always been.
But as a general point, it's something called a public health override. Now, that's a short statement for saying we cannot advise, obviously Dr. Brink cannot advise, we can change things if we need to, and we can change them very quickly, and we will do so. That decision will be made because there is still a significant element of the community, and I can fully understand that, who are going to say, well, my goodness me, this is a big step you're going to take now in 5 or 6 weeks' time, whatever it is. We understand and we respect that. So we want to take the community with us as best we can. And our prime concern will always be the safety of the people of the bailiwick. Lisa?
Just a question in terms of categories. For people kind of transiting through, say, an amber country, but not necessarily stopping and staying the night, will that affect kind of the 14-day history in the sense that they'll have to become an amber passenger from that point on, or will there be a bit of flexibility in terms of whether you're staying over in the country?
We are currently looking at that and talking with the UK authorities about how that will work for Guernsey. So we don't say everything's set in stone, but that is something that we're talking about. So people aren't going to have to double the amount of self-isolation. and that will work for the red countries as well. So we just need to, we're just bottoming that out first. And we are going to provide a lot of different scenarios for people, so it gives them an idea about if they're going to Portugal, what does that mean? If they're going to somewhere else, and it might be an amber or red country, what does that mean? And all different scenarios. So hopefully it will answer people's more specific questions.
For example, for a red country with a managed quarantine, is what we'll be doing is taking into account those 10 days of managed quarantine. If someone has their negative result, is released from managed quarantine in the UK, they can come over here, have their day of arrival, but they'll only be required to do another 4 days. So we'd take into account those 10 days of managed quarantine. So at all times, what we're trying to do is look at the big picture and look at how we can have enough measures in place to protect the population, but that at the same time are proportionate to the risk. So it's that balance that we do the whole time.
Matthew, you had your hand raised.
Yes. Could we have an update on how much longer the Beausejour Centre will be used as the vaccine centre?
Well, I think we're still looking at that, frankly, because we do appreciate, the sporting community have been brilliant. People want that back as soon as is reasonable. There was significant pressure not to use it. Hasn't it turned out to be exactly the right decision? I commend those who made the decision to use it. But it won't be before, it won't be in the next month or two. But the intention is to look for somewhere else in due course, Dr. Briggs, is that right?
Yeah, we're looking at alternative sites, but we also need to look at how we're going to deliver ongoing booster programs, any childhood immunisation programs. So we're looking at it in the round, and that's a piece of work that is ongoing, but perhaps is not well developed enough to discuss in any great detail at this time.
Ewan?
I know that today's announcement is about travel in July onwards, but where are we in terms of an air bridge with potentially Jersey? We're looking at Jersey now as a Category 2 country. It's been over 50 days since they've had a community case. Many people do want to travel between the islands and don't necessarily want to isolate for that time until they get the test result back. Are we any further with an air bridge?
Between now and the 1st of July, really?
Yeah.
Well, the answer is we're not. I mean, the situation is that we've still got, we're quite happy to discuss anything, but we're now the second half of May. The 1st of July is not that far away. I'm not saying it's impossible, but I'm saying it's unlikely that we're going to come to any specific arrangements with Jersey and the Isle of Man between now and then. But who knows? Next question, anybody? Julia.
I think we mentioned the Moderna vaccine a few weeks ago, and I think you said we had it on island, but at that stage it wasn't being given. Is it currently going in? Is it now going into arms?
Not yet going into arms, but because we're using it as part of our schedule. So when it comes into our scheduling, we will use it. It's due to be used. I don't have the exact date, but because you've now asked me that question twice, I'm feeling very remiss that I didn't check. I did have it on my list, but I will check. And at the next briefing, I will specifically let you know the date that we're first going to use it. How's that? Okay, you're welcome.
Ewan and then Matthew.
Potentially a question for you, Paul. The BBC understands that in SARC, chief police are going to pay for their islanders to come to Guernsey to get the vaccine, and we understand that Guernsey is going to pay for Alderney residents. Is that correct?
That's correct as it sits at the moment, yes. Obviously, the numbers are significantly different and the arrangements are slightly more logically difficult for Alderney than they are for SARC.
But also, we've got a different arrangement. We've had it since 1948 with Alderney that we have with SARC. But as Paul says, that could change, but we'll see.
Yep, thank you very much. In my last question, I took advantage of the seamless service yesterday and had my jab. I was wondering, do we have any statistics on people who have called up to turn it down?
Not off the top of my head, but as you can see overall with our vaccine uptake, 92% in the over 50s having received at least one dose of vaccine. It's going to be the minority, but I couldn't tell you how many people have actually phoned the call centre and said, I don't want that. We could perhaps look if that data is available, but I don't have it off the top of my head.
Any other you?
I've got a couple of questions just on testing. One for you, Dr. Brink. I'm sure that you can answer this. I get some emails from members of the public. One question is, if we've had both jabs, why do we need to be tested on return to the island? And some people saying that they've been waiting 30 hours to get a result back, 48 hours, but on average, do you have the rough waiting time for test results to be returned?
So, no, I don't have that. And again, it's something we could look into. We were aware that we did have some issues with some of the barcode scanning, which did cause some people to get their results back later. I think it was a minority of people. I think most were getting them back earlier. But I absolutely do agree that some people had to wait longer, and we can only apologise for that. So that was the second question. The first question?
The first one was about if we had both jabs, why do we need to be tested on return?
Because you can still get reinfections, and people who have had the vaccine can still get infected. They're far less likely to transmit, but we're at a stage at the moment where our population is not yet fully protected. So as we move to the 1st of July, we've modelled it very carefully. So at the 1st of July, everyone over 18 will have been offered at least one dose, and at that stage we think we will have significant population level protection. So it's simply about protecting the bailiwick population at the moment whilst we roll out this vaccination programme.
Any other questions from anybody? Don't see any hands raised, so thank you for your questions. Thank you very much. And to members of the public listening and those that will read about this broadcast thereafter, send your questions in. We look forward to seeing you, hearing from you next week, and we'll do our best to answer the questions. But information will be continually transmitted to ensure that people are aware of where we are and what we're going to do on the 1st of July. Thank you, everybody, very much.